Are you aware that an unexplained itch in a specific location could be your body's subtle warning sign for cancer? While most of us would dismiss a minor itch, for older individuals, especially those over 60, itchiness in very distinct areas could signify something more than simple dry skin or irritation. It might be a signal from your body that you cannot afford to overlook. In this video, we will explore 5 highly specific itchy spots on the body that may point to cancer, sometimes appearing months before any other symptom manifests. These are not just random itches. They are patterns that doctors have observed repeatedly in patients who were subsequently diagnosed with serious illnesses such as lymphoma, pancreatic cancer, and even cancers of the breast or skin. Please stay with me until the end, as we won't just be listing body parts. You will understand the deeper reasons behind each itch, why these particular areas are affected, which cancers they are associated with, and how to distinguish between a temporary skin problem and something more significant. By the end, you will know what to look for, what questions to bring to your doctor, and what steps to take if any of these signs seem familiar. Most importantly, the goal here is not to cause panic, but to encourage attentiveness. The sooner you recognize these quiet signs, the greater your chances of catching a potential issue before it becomes more difficult to treat. Let's get started. Sign 1, persistent itching on the lower legs. When an older adult begins to notice a constant itch on their lower legs, particularly on the shins and calves, without any accompanying rash, dryness, or a new soap to hold responsible, it's tempting to attribute it to aging skin. However, this very precise symptom has subtly appeared in numerous individuals diagnosed with blood-related cancers, most notably lymphoma. This isn't the kind of itch that appears and disappears, it lingers. It often intensifies at night and fails to respond to moisturizers in the way that dry skin typically does. The reason this occurs relates to how cancers like Hodgkin's lymphoma impact the immune system. These cancers begin in the lymphatic system, an essential component of the body's immune and fluid regulation functions. As the cancer cells proliferate, they introduce inflammatory substances into the circulation. A very common side effect of these substances is a profound, almost burning itch that tends to settle in the lower extremities. Even if the skin appears perfectly normal on the surface, the nerves beneath are being agitated from within. A 75-year-old man named George shared his experience at a cancer awareness event. He explained that for almost half a year, his sole symptom was an unmanageable itch on the front of his legs. His physician first suspected eczema or possibly an allergic reaction to laundry detergent. However, when blood tests revealed abnormal white cell counts and further imaging showed enlarged lymph nodes in his chest, the diagnosis was confirmed. The itch came first, he stated, long before anything else. This type of account is not uncommon. While not every itchy leg is a sign of cancer, the primary difference is in how the skin does or does not react. If there is no rash, no new product, no insect bites, and the itching has persisted for weeks, it is time to investigate further. This is especially true if it is accompanied by other subtle indicators like night sweats, fatigue, or unexplained weight loss. For older adults, this level of awareness is particularly vital. As we get older, our bodies may become less direct in sending out distress signals. Pain might not manifest immediately, and lumps may be located too deep to be felt, but the nerves will still react. An itch, especially one that is deep, restless, and unrelenting, is often the first way that reaction presents itself. If you or someone you know has been scratching their legs every night using creams without success and wondering why it's not getting better, do not disregard it. Speak with a doctor, inquire about blood tests, and describe the pattern. Sometimes the body's whispers come long before it shouts, and being able to listen can make all the difference. Sign 2, itching between the shoulder blades or on the upper back. There is a particular kind of itch that can manifest deep in the upper back, located right between the shoulder blades. It is often disregarded or attributed to poor posture, dry air, or even the tag on an old shirt. Yet for many older adults, a constant itch in this specific location, especially one that feels as if it originates from beneath the skin, has been connected to pancreatic cancer. Strangely, it often emerges months before any distinct pain or digestive issues arise. At first, the link may appear strange. How could an internal organ such as the pancreas lead to itchiness so high up on the back? The mechanism works like this. As pancreatic tumors develop, they can block the small tubes responsible for draining bile from the liver to the intestines, known as bile ducts. When this drainage process is impeded or halted, bile salts begin to build up in the blood. One of the initial effects of these excess bile salts is the irritation of nerve endings, often in regions like the back, where a dense network of sensory nerves is located. I recall a 70-year-old woman named Linda who mentioned having what she described as a phantom itch on her upper back. She would wake up scratching it nightly. No remedy worked, not lotions, back scratchers, or even a new mattress. She described the sensation as feeling like it came from inside. When she later had blood work done for unrelated tiredness, her liver enzyme levels were high. This prompted imaging scans, which ultimately revealed a small tumor in her pancreas that was compressing the bile duct. The unsettling part was that the itch was her only significant symptom. There was no pain and no skin yellowing, just a deep, persistent sensation she couldn't ignore. The only reason it was discovered early was that she voiced her concern, even though it seemed like a minor issue. This is why that specific location is so important. General itchiness on the back can be caused by dryness, pressure, or rubbing. But if the itch is concentrated, relentless, and shows no improvement with skin therapies, particularly if you've also observed darker urine, pale-colored stools, or fatigue, it might be a more profound signal of an internal problem. The back serves as the messenger even when the issue lies within the digestive system. For older adults, it's easy to set aside these kinds of subtle symptoms. We may not want to appear overly dramatic, but your body is often more perceptive than you realize. When it sends the same signal over and over, it is worthwhile to pay attention, even if it is just an itch. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Sign 3, an itchy scalp without visible flakes or dandruff. An itchy scalp may not seem like a significant problem. For many older adults, it is easy to attribute it to dry air, aging skin, or a shampoo that isn't quite right. However, when the itching becomes constant, especially in the absence of dandruff, redness, or flaking, it can sometimes be an early indicator of a deeper issue occurring beneath the surface. This can include blood-related cancers such as leukemia or skin cancers located on the scalp. What distinguishes this itch is that it often feels more like a tingling, crawling, or burning sensation rather than simple dryness. It might shift from one area to another and typically does not respond to common remedies like anti-dandruff shampoos or moisturizing scalp treatments. For individuals over 60, sensations like these can suggest nerve irritation caused by abnormal immune responses, which can happen when leukemia cells start to increase in the blood and disrupt the body's ability to control inflammation. A 73-year-old man named Henry mentioned that his scalp had begun itching every afternoon. He first switched his hair products, then considered that his hat might be the cause. But even after changing shampoos and not wearing a hat, the itch persisted. When he eventually underwent a complete blood panel for unrelated fatigue, his doctors discovered unusually high white blood cell counts. A bone marrow biopsy later confirmed an early stage of chronic lymphocytic leukemia. His scalp had been the very first and only part of his body to alert him. What makes this especially critical is that many older adults already deal with some degree of dryness or skin sensitivity. As a result, when an itchy scalp begins to feel normal, it gets overlooked. But what differentiates a cancer-related itch is its resistance. No cream provides relief, and no product offers comfort. It stays, nags, and often seems unrelated to any surface-level issue. While leukemia is not the only potential issue, skin cancers that form on the scalp, particularly in areas where hair is thinning, can start as nothing more than a small, itchy spot. It might resemble a patch of dry skin or a tiny bump. But if it continues to itch, especially in the same location, and doesn't resolve, it needs to be examined under proper lighting by a dermatologist. Since the scalp can be difficult to inspect by yourself, it is beneficial to ask a spouse, caregiver, or even a hairdresser to check the area periodically. If you are experiencing an itch that has remained for weeks and is not improving with anything you have tried, That is your cue to look deeper, especially if you have also been feeling unusually tired, bruising more easily, or just feeling off in a way you can't articulate. It may seem like a trivial matter, but sometimes the small, persistent things are what reveal the biggest truths. Sign 4, localized itching on the chest or breast area. When older adults, women in particular, but men as well, observe a persistent itch on the chest or breast, especially around the nipple or just under the breast, it's common to attribute it to sweat, a tight fitting shirt, or age related skin changes. However, this specific location is one of the most frequently missed spots where itching can signal something much more serious: inflammatory breast cancer or other tumors located near the chest wall. What is unique about this sign is that it frequently appears before any lump can be felt. The skin may feel warm, irritated, or constricted. In some cases, there might be a textural change. It could be slightly rough, thicker than the surrounding skin, or have a reddish appearance. But just as frequently, there is nothing visible at all, only a deep, constant itch that never seems to resolve, regardless of what cream or lotion is used. I am reminded of the story of Ruth, 69, who started to feel a strange itching sensation around her right breast. She changed her bras, tried different detergents, and even stopped wearing a bra for a time, assuming it was due to friction. Yet the itching persisted in the same spot day after day. When she finally had a checkup, her doctor observed a slight dimpling of the skin and ordered additional tests. They discovered a small yet aggressive tumor growing near the skin's surface. Without the classic round lump that most people anticipate, this is a key reason why inflammatory breast cancer can be so hazardous. It doesn't always adhere to the expected patterns. It can resemble a skin rash, spread rapidly, and its earliest symptom is often irritation rather than pain. This is why it is so crucial to pay attention to itching that is stationary, does not improve with moisturizers, and is consistently focused in the same area day after day, particularly on the breast or chest. For men, this can be even easier to overlook. Although male breast cancer is uncommon, it does occur and often remains undiagnosed because its signs don't align with what most men are conditioned to look for. An itchy area near the nipple, a small patch of thickened skin, or a persistent mild discomfort under the chest muscle might not seem alarming, but for someone in their 60s, 70s, or 80s, it warrants a closer examination. Furthermore, this type of itch is not always indicative of cancer within the breast itself. It can also be a result of enlarged lymph nodes under the arms or just beneath the collarbone, which could signal lymphoma or another malignancy in the vicinity. Therefore, if the itch is accompanied by swelling, warmth, or even a subtle feeling of heaviness in the area, do not delay seeking medical advice. Early detection does not begin with sophisticated equipment. It begins with awareness, with listening, and with noticing the quiet, out of place patterns. Your skin cannot speak, but it can send signals. And this is one of the most vital signals not to ignore. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Sign 5, persistent itching in the anal or genital area. There are few things more uncomfortable and more frequently disregarded than itching in the anal or genital region. It is an awkward topic, particularly for older adults, and many would prefer to dismiss it rather than discuss it. But when this type of itching becomes chronic and lacks an obvious cause, such as hygiene, infection, or irritation, it may be an attempt to alert you to something far more serious. In certain instances, a persistent itch in this area can be a subtle early symptom of anal, vulvar, or even penile cancer. What makes this type of itch perilous is that it often presents itself as a minor issue. People tend to assume it's simply dry skin, a reaction to toilet paper, friction from walking, or perhaps a side effect of using incontinence pads. And in many situations, it is. But when it persists for weeks or months, returns despite cleaning, treatment, or moisturizing, and starts to feel more raw or burning than superficial, it merits a closer examination. A man named Eugene, 76, had been coping with what he believed was hemorrhoid irritation for nearly a year. He applied creams, modified his diet, and even used cold compresses, but the itching never completely subsided. Finally, a colorectal specialist performed a scope examination and discovered a small lesion on the wall of the anal canal. It was an early stage tumor, something that would have continued to grow undetected if he hadn't trusted his intuition that something was not right. The same is true for women. While vulvar cancer is relatively uncommon, its incidence increases after the age of 60. One of its earliest signs is a recurring itch on or near the outer genital area. A lump may not be present, but the skin might start to feel rougher, have a slight discoloration, or seem thinner than normal. Many older women presume it is related to hormones or postmenopausal dryness, and sometimes that is the case. But if the itching is unrelenting, gets worse at night, and does not improve with standard treatments, it should not be dismissed. This part of the body is rich with nerve endings and is highly sensitive. Because of this, it often signals internal changes before more visible symptoms appear, whether it's a change in skin cells, nerve inflammation, or swelling in adjacent lymph nodes. Chronic itching in this region, especially if it is confined to one side or concentrated in a single small area, can be a warning sign. Yet, most people are hesitant to mention it. They worry about embarrassment or think they are overreacting. But silence is far more dangerous than curiosity. Speaking up about an itch could be the key to early detection, better treatment outcomes, and peace of mind. The most critical takeaway is this: if the itch does not resolve, do not assume it's normal. Let a healthcare provider examine it. Catching something early, even a condition as serious as cancer, often begins by noticing something small and subtle and choosing not to ignore it. Final thoughts. As we conclude this video, I want to leave you with one simple truth. Your body is constantly communicating. Sometimes it communicates through pain and other times through fatigue, but often it starts with something so minor, so subtle that we overlook it, like a persistent itch that always returns to the same spot. The 5 areas we discussed today, the lower legs, upper back, scalp, chest, and genital region, are not just arbitrary locations. They are places where serious internal issues, including certain types of cancer, often send their first quiet signals. For older adults, learning to listen to those signals could mean the difference between catching something early and allowing it to grow silently. You do not need to live in fear. That is not the intention of this video. The purpose is to empower you, to remind you that your instincts are valuable, and that what may seem like a minor symptom could be your body's way of asking for help. If any of these signs resonated with you, do not dismiss them. Discuss them with your doctor. Initiate a conversation because you are entitled to answers and you deserve peace of mind. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.